But do please stick questions in the chat as we go along, and we'll pick those up after the individual presentations, or stick your hand up when we come to the Q&A session at the end of each one. So first of all, we have Caroline, who is the Health and Environment Lead Advisor for the East Midlands from Natural England, who's going to talk to us about their work relating to health and the environment and green social prescribing. So Caroline, over to you.
Are you there, Noor?
Hi. Yeah.
So I'm Caroline from Natural England, from the East Midlands. But Noor, my colleague, Noor Khan, I work with closely covering the East Midlands, and I've had some microphone problems, so she's going to just give a little bit of a summary from all of us, on behalf of all of us.
Yes, so hi everybody, my name's Noor and I work alongside Caroline as the Health and Environment Lead for the East Midlands. So we share the region geographically, so I cover counties of Lincolnshire, Leicestershire and Rutland and Nottinghamshire, and Caroline covers Derbyshire and Northamptonshire. And our other colleagues are Jenny King and Amber McCand, and they look after the West Midlands. So just a little bit about what we do. Broadly speaking, our roles exist to support health and wellbeing activities which focus around nature. So we're always looking to create relationships with green providers as well as those involved in the health sector, and just building relationships between them. And because we believe in the importance of developing a strong sense of nature connection in maintaining a healthy body and mind, we actively share evidence and information around with our networks, and we can help them to anybody who's delivering green social prescribing projects to help find funding opportunities. And all our email addresses are listed on the slide if anybody wants to contact us, whether that's just a simple introduction or if you've got any ideas about setting up activities in your parks to get people moving. We may be able to help you find participants and link you up with relevant organisations or help you find suitable funding, or maybe you just want some advice about how your activity could be strengthened by having a focus around nature connection. So please feel free to get in touch.
Okay, thanks, Noor. Caroline, was there anything else you wanted to say on that?
No, it seems to be working. No, I think Noor's given a very good summary, really. But I'm here with Noor to, take any questions.
Okay, great. Okay, so if we'll move on to Sarah then, and then we'll come back and pick up the questions for you as a group at the end of this section. So it's over to you, Sarah. So Sarah Paine is the Midlands Regional Lead for the Thriving Communities project from the National Academy for Social Prescribing.
That's right. Thank you ever so much for the introduction, and thanks for having me here. So I am I'm actually covering for one of my colleagues in the regional area, Alex, who's our physical activity coordinator. And so he's put this amazing presentation together that I'll go through with yourselves today. And I have just put on my hotspot just in case my internet does cut out, but if it does and I do disappear, bear with me and I'll connect with you very shortly. But let's hope not. So as a whole team, we work with Caroline and Noor and the others that have just introduced themselves. So there's a whole regional support that we provide. My role, unlike the others, doesn't have a activity focus. So Sports England and Natural England and others have got a regional remit within our work, and so I'm going to be speaking mainly from the physical activity role that Alex delivers, and touching upon green social prescribing. But I'll go to the next slide and share a little bit more about the outcomes for today's session. So I aim to cover a bit of an intro and explain the role of the Midlands Regional Social Prescribing Physical Activity Coordinator, so that would be Alex, a bit of an explanation of green social prescribing, and an update from the 2 Midlands green social prescribing pilots. There were 7 across England, and the only region that got 2, I believe. So it's important for us to cover that topic, and then an opportunity for questions and further meetings, hopefully. So if we could move on. So Alex just wanted to give a bit of a background to his role, identifying that he's funded by Sports England and also part funded by National Academy for Social Prescribing that I work for, and the Midlands Active Partnerships. There's 42, one in each integrated care system. If an integrated care system isn't something you're familiar with, then you need to join the Learn Together programme, and I'll speak more a little bit about that later. So if there is anything I do share with you today, there is opportunity to find out more. The focus of Alex's role is to support the connectivity between social prescribing and physical activity. So he's put here, number one being providing the support, training, resources to the sport and physical activity workforce, social prescribers, that's the referrers, and the voluntary community faith and social enterprise groups, which are predominantly yourselves. Number two is about sharing learning and best practice through the leadership and advocacy. And number three, he's put as encourage unconventional partnerships and embed physical activity and other settings to new settings and encourage growth in existing opportunities. So we can collectively cover quite a lot. So I think the key is about being in touch. So if we move to the next slide, there is an emphasis of this, and even a picture of Alex, so you don't forget him if you see him in passing. And as his picture arrow implies, he has got a few more grey hairs, and I can advocate that's the case. So his role is hosted by Active Partners Trust. He's based in Nottinghamshire and Derbyshire, and had a coordinator in post until March 2023. So that's a bit of his background. And the role then went back out to advert, and he was awarded to Everyone Health Limited, who are a national healthy lifestyles organisation. And he's put in brackets, if you want to know about them, everyonehealth.co.uk, you can go to and find out a little bit more. And they run a public health services across the country. So we felt he was very fitted for this regional role. So Alex is the representative from Everyone Health, who leads on this for 22 hours per week with his usual working days, Tuesday, Wednesday and Friday. And Alex is a big advocate for physical activity on parks and open spaces, and has worked across Nottingham, Leicestershire on physical activity programmes such as Park Lives, Ping, Nottingham Walking for Health and Run Cycle programmes. So he's basically showing off that he's got a bit of expertise there, and you should really get in touch. So if you haven't already, maybe made a note of his email address and number there. He's very keen. Do feel free to reach out to Alex. As you can see, he's got a wealth of experience to offer, and he'll be very keen to find out about your work, and as I'll go on in the next slide, sort of the context of social prescribing and how we can support you, perhaps if you want to understand that work and world a little bit more. So this is about the regional social prescribing and physical activity coordinator role. How can the role support you? So here's some ideas if you haven't had some already. So he can obviously help support parks and open spaces, as mentioned in the previous slide, but specifically he's given some examples around helping to shape upcoming strategies for sport and physical activity on parks and open spaces, supporting providers of sport and physical activity on parks with connectivity to the health sector to boost group attendance numbers and improve health and wellbeing outcomes. And he's put in a link which I'll actually chuck in the chat as well. I had it prepared. There's also Thriving Communities. There's my NASP national page that we've got, but I've put in the Learning Together programme in the chat that gets you directly to the Midlands. So if you did want to know a little bit more beyond the Midlands region, please do let me know. Happy to, or equally, it is easy to Google National Academy for Social Prescribing, get their main website, and you'll be able to find Thriving Communities on there. So there's also supporting with funding applications and training on physical activity that he can offer, and get in touch to discuss more, because he may have not listed all of them, but I'm sure there'll be lots of reasons for you to be in touch with Alex. And we, like I say, we do work as a team, and if you have work that might be broader than your parks, something kind of being asked a little bit out of the remit, then I could be of assistance there as well. Moving on, we've got the next slide coming. I think it's delayed my end. There we go. Green social prescribing. So what is green social prescribing? Is really just touching on it here. And apologies, I'm going to read the slide because he has just articulated information very well. But if you do want to know more about social prescribing as a whole and its complexities and how it's different across piece, the Midlands Learn Together programme is the opportunity to understand a bit more there. So Alex has put here about green social prescribing includes both what is known as green and blue activities, so what's outside. These could include local walking schemes, community gardening projects, conservation, volunteering, green gyms, open water swimming, or arts and culture activities which take place outdoors. So you can tell it's going to be a long list. These activities may be prescribed, and what we mean by that is the link worker alongside other forms of support, e.g. referrals to support for housing or finances based on the needs and circumstances of each individual. So that's someone going through a formal route to be prescribed to for their health and cross-governmental green social prescribing project is testing how to embed green social prescribing into communities in order to improve mental health outcomes, reduce health inequalities, reduce demand on the health and social care system, as we know is a very critical point, and develop best practice in making green social activities more resilient and accessible. So there was 5.77 million committed to supporting 7 test and learn sites across the country, including 2 in the Midlands, and they were based in Derbyshire and Nottinghamshire, across the Derby and Notts. Can we move on to the next slide? Not sure if there's a delay or if it's thank you. It's definitely a delay. So here's about the Green Social Prescribing Project. So I spoke about the Midlands and our work as regional team, but and touched on what is social prescribing and referred to the Learn Together programme to learn more about that. And now we're going to go into a bit of the project, but I'm only going to speak about one in particular because Amanda is the one speaking about the Nottingham green space, and here is Green Spring in Derbyshire. So Green Spring covers Derbyshire and Derby City, and it's been running since April 21 to April 23. The pilots may or may not get funding to continue this work, but we're hoping to find that out very soon. So fingers crossed. Their aim was to work to define the system change needed to realise the potential of green social prescribing, GSP. So instead of trying to prove that green activities are good for us, more looking at how the system is working and what can be done to help the system work better. So lots of testing took place, and that included talking to social prescribers, talking to providers, talking to people that are referred to social prescribing. And some of these activities taking place include forest bathing, mindfulness, movement, allotments, walks, and litter pickers. So that was just, and we can move to the next slide to give you a kind of list of examples. But that network, as I've attended some of those meetings, very broad, and they are, gathering momentum. And they've really kind of reflected on what they've achieved and what their kind of understanding of the system is, which has been really quite complex. And it is very much moving. So like I mentioned earlier about the integrated care system, that is very new. And therefore, that's why I flagged you may not have heard of it before. And please join the programme if that's the case and hear a bit more about it. But it does indicate a big shift in our NHS. Not only social prescribing being a big shift with personalised care, but that also as a whole system, they're looking to be more joined up. So here are some reflections I'm going to go through from the slide. What is a good social prescriber? So that they recognise it makes a massive difference if the social prescribing link worker how they like contact the patients, how often do they follow up the calls, do they do a warm handover. What I mean by that is perhaps joining them in their first session. So if they identified that this person needs a little bit of support to get to your park, to get engaged in something going on there, and therefore have they got the capacity, or someone like a voluntary centre, are they working with them to support that process, and someone being able to reach those activities. So that was a big factor, kind of those social prescribing link workers. Many patients signpost posted to an activity and are often to complex in health terms. So if there's a high number of complex cases, that can be a challenge if there's a lot of providers who perhaps can't meet that need or not set up to. And therefore it wouldn't be either they're referring inappropriately or they're not able to help them, and therefore the referral kind of gets a little bit stuck. So there is a real challenge there about what the GPs, because it's typically through a GP that will refer these patients to a link worker, unless it's well established and there's enough link workers to take on beyond GP referrals, but in most cases it tends to be GPs. There's also travel and costs that are a big barrier for patients. Patients are sometimes unlikely to go outside their place of home or locality, even if there is transport provided. So it's kind of recognising that there's big confidence issues maybe there in going to new places or trying something new. And actually the cost of living is, as we all know, of multiple crises is a big barrier as well. Some providers have barriers to getting involved with the health system due to paperwork needed and perceived hassle. So if they're kind of wanting a kind of quick way of just getting the help they need, but actually it's taking longer or there's a lot more involved, they tend to then disengage. So the process, I guess in a way, if it's not slick, it's then something that can be quite frustrating. And I think social prescribing, having now worked in it for a couple of years now, it's definitely messy and it's got some good practices going on, but I wouldn't say there's anything that would say is perfect and seamless. So it's certainly a massive barrier for most places. There's always something in the system that isn't helping. They've also come across data as a problem. They can receive number of people referred from a GP to a social prescribing, however, no details of the numbers of people or the social prescribing signpost towards green activity and outcomes of this are then affected. So if the GP has referred a patient, then they've given perhaps limited information, they've got even less information to go on to then go further into the onward referral into the community. And that proves a massive barrier to then those providers being able to meet the needs of the people coming into and using their parks or activities being held there. So there's lots of different data systems used across the city and county. They found in Derby social prescribing specific systems or GP systems and others. NHS have like an EMIS and System 1, and sometimes they can be really hard to connect with. And if a link worker is not employed directly by the GP practice, which is often the case, then that can the barrier of systems not aligning can be a massive one, and really hard for therefore referrals to be made in itself. So it is therefore hard to compare like for like, especially in terms of the activities delivered as well, if they're not well recorded, and if there's a lot of providers are delivering a very vast different number of things, and that's hard to kind of say this specifically aligns to others doing something similar. Then there's social prescribers are unsure of accreditations of providers, so it's about like that quality mark. So this leads to less signposting if they're not confident, or if they can't find them, or if they're not attending the right sort of networks or using the database that everyone's using or something along those lines. It can be really problematic. And then the social prescribers caseload becomes too much, meaning less of a personal approach because they're not able to invest in that person and take the time needed to get to know what their underlying issues are and how they can help, and therefore less referrals. So what we are finding from, well, what they found from green providers is that they typically get a lot of self-referrals come through. So I guess this is a real point around managing expectations, that just if you're connected to a link worker doesn't mean all of a sudden you get a flood of referrals coming into something you're providing. There may be a lot more self-referrals still coming through as the main pathway, but we are, and as has been identified, needs a lot more work around how we better connect link workers to charities and community groups and voluntary groups and social enterprise groups to ensure that there's better referrals being made and people aren't missing out. So the next steps for Greenspring, with their funding closing at the end of March and no decision made on the extension, they're going to pull together their project evaluation. It's been written up now for the March, for end of March, and they're going to continue with the network, hopefully, and look for sort of support to continue it. So if this sounds like something you want to be involved with, if you're, especially if you are based in the Derbyshire area, please do feel free to take those details you can see on the slide to get in touch with Greenspring, because that network is very strong. And I'm aware that they're involved in other pieces of work in Derbyshire, one about how to move away from funding models to investment models, and how we build stronger networks together as a sector, holding money, ensuring that it flows, held by third sector and flows into the third sector much better, and so we're less reliant on funding and commissioning and other short-term funding streams that are currently in place. So they are a very good network to be part of, even if maybe their specific work isn't of direct interest to you. So I think the next slide would be going on to Amanda. Would that be right? Yeah, so Green Space will be speaking shortly when Amanda joins about the Nottingham pilot, which is very different in terms of they've actually trialled lots of activities and seeing how that is in practice, whereas Derbyshire did take more of a sort of, what is the system that we're having to join up and work with? How do we actually do that? What would that involve? And I think their report will be incredibly enlightening. They haven't shared lots about their kind of, a lot of reflections on the barriers, but I think they'll produce more of the suggestions that could improve practice as well. And I certainly am hopeful that we will be able to make good headway in places, and especially with that network having formed, there is a lot around strengthening the third sector voice, and this is a lot about my work at National Academy of Social Prescribing, and what we do regionally is our collective aim is to support you all and to give you that collective voice. So if something's happening in a specific, support you locally to kind of look at the issue that might be stopping you from either connecting with that link worker or receiving referrals, as we have done, or certainly am doing across the Midlands. So I will end there just to give time for Amanda when she does arrive, and ensure that the meeting doesn't go over. Would that be helpful? And obviously to give time for question and answers, because I've gone on quite a bit there.
Yeah, great. Thank you, Sarah. That's really useful. Good introduction to the Derbyshire project there. Happy to take some questions now before we, I don't think Amanda's in the room yet, so I'll come to Nick and Tommy in a second, if that's all right with you guys. We'll switch things around slightly, as we said we might have to. Are there any questions from anyone for Sarah before we move on? Please just stick your hand up or stick something in the chat if you want to. Okay, so while we're just waiting to see if anyone's got any questions, I guess one of the things I wonder is, what's your hope from the National Academy in terms of where green social prescribing would ideally go? Oh, and it looks like she's frozen at exactly the wrong time.
Oh no.
Oh, did you get that?
Can you hear me? Yeah, I did hear you, yes. And then I heard you say that I froze. I was like, oh no, bad timing. So obviously we partner with Natural England, who have introduced themselves on here. And we work together regionally. So NASP also do that.
Oh no.
We actually support each other on issues that might be coming up. Can you hear me okay?
Yeah,
Just
yeah, I've got you.
checking. It hasn't frozen. Yeah. Is that useful? Is that the kind of, or have I misunderstood the question? Please do say. Happy to.
I think I might have missed the middle section of what you were saying. I don't know anyone else.
Yeah, I missed that too as well, James.
Oh, okay. I think it might be you then, Sarah, rather than us. Do you want to just say the middle bit again?
Absolutely. I'll just quickly say it in an overview. So National Academy, they have national partners such as Natural England, and then we're kind of replicated on a regional level. And so this allows us to ensure that there isn't duplication of work, and that Natural England is Prescribing that we specifically focus on as Thriving Communities regional leads. So that was a recognition that we needed to support the end referral, i.e. from the link worker into the community for parts as such like. Otherwise social prescribing doesn't happen. So we're giving that focus and support and working with partners like Natural England, Sports England, etc. to ensure there is joined up support available.
Okay, great. And then presumably your ambition is that this just becomes normal practice and that the pilots turn into kind of day-to-day, national practice across the whole country?
Absolutely, yeah. So I think Nottingham, which you'll hear more about, some of the examples are really what we would definitely like to see is happening across the board, especially something around like the warm handover, the kind of support might be needed for people to access activities in the community, as an example, but they'll share a lot more about things that they've been piloting to see if it works in practice. So yeah, absolutely, this has been really useful piloting work, but I think Nottingham more so would value to continue, because I think they're just in a really good flow at the minute. So hopefully they'll find out shortly if they can. But yeah, and this is partly why I would like to personally and advocating for and supporting the group that is looking at moving away from this short-term funding commissioning into investment, because it's just unsustainable, this way of doing things. Piloting something great, but only with the view that it will always need some level of investment. And that, I don't think there's very rarely anything that I know kind of takes place for a few months and then it just ups and runs and is self-sustaining. It's really hard to achieve that in any sort of short-term period, whether that's 1-2 years. It takes a lot to get things grounded. So we would like to see for the third sector a whole shift in how we're partnered with, how we're financed, etc. So it's one of the big reasons to be part of a network, because that voice will be even more heard in this space. The Learn Together programme is part of that membership of being that voice to say whether it is or isn't working for you in the community and how we can best progress things.
Okay, great, thank you. And Amanda's right. But before we go to there, we'll just take a question from Sarah. You've got your hand up.
Thanks. And I have spoken with Karen actually from Green Springs in Derbyshire, in Chesterfield, about the social prescribing a little bit. And I was just trying to get my head around it in terms of, I think there's different levels, isn't there? Like level 1, level 2, level 3, and level 4. And it was just really what we can do as like parks providers, whether we can offer kind of self-led. Because I don't know if we've got that capacity to run specialist sessions to offer like a level 4. It's what if there's any sort of prerequisites required to be able to say, we've got this green space and here you can do A, B, and C. And it was just getting my, the thought process around that really.
Absolutely, Sarah. I'm so glad you brought that up. I said to Alex, aren't you missing this really big piece of work that they did about the levels? And I then had a concern that perhaps there was a reason why they didn't sort of suggest putting it in. So but actually, if you're saying that was your experience in speaking to them recently, then I'm happy to talk about it a little bit more. So those levels aren't to say that you have to be doing, so for the benefit of everyone else, it's a little bit like identifying levels of need or mental sort of, and Amanda will talk about how they use mental health levels, but this is about kind of providers being able to go, I think our work does cover level 1 and 2, but not 3 or 4. And the reason for that is so that referrals could be much more appropriately made. So it isn't about you having to fulfill all those descriptors and requirements. It's about you saying, I just do this. This is my specialism right here. And it might just be one level, and that's absolutely fine. What we're trying to improve within social prescribing and referral process overall is that there is a clear understanding about the diversity and wealth of amazing talent that's in the third sector, which is really not seen and not understood at all. And these descriptors will help with the level of that. But so Green Social Prescribing have obviously started that process. Sports England have quite clear descriptors to some extent, but this piece of work is something that I'm looking to develop for the arts and culture, for example, and where they need to also cross-lay against each other to some extent. And Amanda can talk much more eloquently about this than I can, especially having, you know, trialed a version herself, whereas not Derby has developed the descriptors, and correct me if I'm wrong, Amanda, Nottingham's actually used a more standard mental health model and seen what it's like and how that might impact and support that referral process. So it's slightly different, but with the same aim of trying to improve that informed referral process. So I'll shut up and let Amanda kind of come in. I think it's around that point.
Thanks, Sam. Welcome,
I think
Amanda. You timed that
thank you.
perfectly. You must have a sixth sense when your
I know,
slot
I
was
know.
hit due.
Yeah, sorry I couldn't come earlier, just come from another meeting. I think you described that really well, Sarah. Ours is slightly different in Nottinghamshire. It came from discussions from both green providers and with link workers about the concern from green providers about were they going to be overwhelmed with referrals or get referrals that where their mental health level was something they didn't have the right skill set to cope with, but also that some of them were really clear that they only wanted to work at the very mild end as well. So, and then equally at the other end, the link workers said to us, you know, it's no good just having a list of providers out there. We need to really understand from the providers where their comfort level is, what they can offer, and so that we place our patients appropriately. So it came from both ends of the referral pathway. So we work with our mental health trust locally in the ICS, who were developing a patient-centered approach to everything. So rather than someone coming into a mental health service and said, well, you're going, you know, that's the offer and that's it, there were distinct pathways being developed of services around a patient's need. So there were kind of 5 levels really, and one being very, very mild, and level 5 probably being at inpatient level and much more severe. So we adapted those to give the link workers and other referrers a guide to, well, I've got a patient here who's probably around level 3. So what I'm looking for is green providers out there who are comfortable and able to deliver at that level 3 level. So it's been a really useful tool when working with green providers and with referrers. But it also allows us to do some gap analysis as well. So if we look and see that we've got lots and lots of providers, green providers at level 1 and 2, we haven't got them, and we haven't got many at level 3 and 4, then we can work to improve that. So it allows us to build confidence in all levels of that referral pathway to do that gap analysis. And also it links into the mental health trust and the transformation work so that they can build GSP into all of their pathways around all of their work that they're doing. So it's not something that stands alone. And so that's how we've used it.
Great, thanks, Amanda. Sarah, do you want to just pick up on that question Alison raised about the role of kind of friends and groups and networks before we move on to Amanda's presentation?
Oh yeah, I just put it in the chat. I just sort of mentioned that that people can connect to the programme, which has a resource page of sort of link workers across the Midlands, for those that will complete the Midlands map. But the best thing to do is to join that programme, because that's a network and anyone can. It provides all the updates you would want, and it just gives you the opportunity to like connect one-on-one with me at any point. So it's just a really good, useful resource for people to look at the programme and just, yeah, because the minimum commitment is receiving a monthly newsletter. So that's that with updates, and then you can do as much or as little as offered beyond then, really.
That's great. I mean, so I didn't want to come in just about, sorry, and answer that question. I'm jumping in here, but we see Friends of the Parks as, yeah, absolutely part of the ecosystem for green social prescribing. We heavily promote self-referral as well as referral from social prescribers and link workers. And where we see Friends of the Parks, we encourage link workers to think of volunteering as a prescribed activity. So often a friends group can welcome new volunteers. That volunteer may have come through a link worker referral, but they're moving into a group that is welcoming and friendly and is set up there to encourage them, and seeing that volunteering as a prescribed activity. So we've, through our Nottingham Open Spaces Forum, we're encouraging friends groups to, if they want to, and again, this is all optional, if they want to be to be a trusted provider and be something that links into link workers.
Perfect, great. Okay, so as I said, Amanda, that was perfect timing. So for those who aren't aware, Amanda is the programme manager for the Green Social Prescribing project. So over to you and your slides. I think Liz has got up on the screen already.
Thank you, brilliant, Liz. Have you got the sound for the slides? Because there is a very short video in the middle of it. So when you share the slides, did you activate sound? Hopefully.
Sorry, no, I looked through and I couldn't see the link for the video, sorry, but
there's no link video, but there is a video in there, so just need you to activate sound. It's slide I think it's slide 5 is 6. Yeah, it's a video that says Peer Support Dementia Hub. So when you share the slides, there was a box to tick to say that sound is enabled.
Okay, I'll do my best, Amanda.
Might be with unsharing and reshare, perhaps, Liz, if we haven't ticked that. So we can try that.
Sorry to be a pain. Reshare.
Got yeah.
And there should be a little box that says, do you want to enable sound when you share?
Yeah, found it.
Fab. Brilliant. It's always a good trick to have up your sleeve, that one. It's something you learn after about 400 Zoom and Teams calls.
Yeah, right. 500 settings in Teams, isn't it?
That's right, absolutely. You know, it's a little tick box, but where is it? Anyway, hi everybody. I'm Amanda Chambers. I'm the programme manager for Green Space. So we are one of the 7 test and learn programmes around green social prescribing, covering Nottingham and Nottinghamshire. Could I have the next slide, please? Thank you. So, yeah, I'm going to talk to you today about the benefits of vitamin G, as we call it, on people living in our communities, and some of the way that we're working with Green Space. So you obviously know what green social prescribing is, but it is all about connecting people into nature activities. It's about improving their health, their well-being, their resilience, and our little strapline is growing healthy people connected to nature. Look for the next slide, please. I feel like Chris Whitty, yeah. So just as a recap, we are one of the 7 test and learns. It's all about improving, for the focus of this test and learn, the mental health and well-being of communities. But we realise that also links into physical well-being. The two are so closely connected. And we have a particular focus across the city and the county about people experiencing the greatest health inequalities. And also people who are really struggling and don't have easy access to green space. And we do that by connecting people into a whole range of nature-based activities, green community projects, and also blue as well, blue activities where one of our key partners is Canal and River Trust. So connecting those into them. And the key aim of what we're doing is about embedding green social prescribing into our local health and social prescribing system, so that it's an intervention of choice for healthcare professionals. So we don't see this as a project that sort of starts and stops. This is very much about green social prescribing being embedded into working practices, into strategy, into policy, and being a fundamental part of how we deliver health across the city and the county. To support that, I'm employed by Nottingham CVS, and that was a conscious decision by the ICS to place the programme with the voluntary sector because of the connections that we have into the voluntary sector, and because it's the voluntary sector that are the deliverers for the activities and the assets and that experience. So we felt that was really key. But we closely link into the personalised care team in health in our ICB, and they drive personalised care, social prescribing, and really looking at this piece of work as a live laboratory for how do we make social prescribing work, and what learning can we take from green social prescribing to take across wider social prescribing. So we're really well connected into voluntary sector through being based in NCVS, and then also connecting into the health system. Could I have the next slide, please? So this is really just a simple, very simple diagram of how we see green social prescribing. We talk about social prescribing link workers, but link workers are only part of the system, really, and lots of other people do social prescribing. So our ambition is that, and our aim is that green social prescribing goes into all of those different pathways. So we work across the Mental Health Trust, we work across the roles such as link workers, health and wellbeing coaches, mental health practitioners, but equally also working through adult social care with community connectors. And then also with a range of community-based mental health services and organisations that can help connect people in to green activities. So if you start with the individual on the left-hand side of that slide, typically they may go through into a GP, they may go into another primary care connection, they may come in through a mental health service, social services, adult social care, and have a conversation with a link worker, with a community connector, with another healthcare professional. And that conversation is about what matters to them. And out of that, they'll have a discussion about being involved in green and nature-based activities. And there'll be a link made, a referral made into those community providers. In some cases, you might get a direct referral where an individual goes direct to a link worker. That does happen. They don't go via their GP. Or equally, you might have a mental health service that doesn't go through a particular connector and takes them straight to a provider. So there's multiple pathways in. But the aim is really about how those green providers can help that person manage their mental and physical well-being and then take part in that activity. So the orange bit is the patient pathway, and you can see there's different routes through there. What I think is quite interesting to know is that nationally, 20% of visits to a GP are for a non-medical condition. And that's the real value of the work of link workers and other community connectors, that those 20% that don't need to see their GP for a medical condition, they don't need a clinical intervention, that an intervention by a link worker, so it could be around a financial issue, a debt issue, it could be around a housing issue, it could be a mental health issue, it could be a range of issues around a wider social determinants of health, that green is there as a solution, as an opportunity for them to have a non-medical intervention away from that clinical setting. And then just on there, I talked about volunteering really briefly as a social prescribed activity. And equally, we're looking at how volunteering obviously is a big part of the the voluntary sector and the providers, but also we're looking at the role of green buddies, and we're working with Natural England on a pilot around how volunteers as green buddies can support patients to take part. Typically, the kind of people that we'll see in these pathways do need more help and support to take part, particularly if they're going through primary care and even secondary care. So there are people who are more vulnerable, higher levels of anxiety, higher levels of social isolation, and need that level of support to take part. But if you notice the bottom yellow line, we've got an individual going directly to a provider. So we encourage self-referral. So for people who can make the decisions themselves, who can have the wherewithal and the confidence to get out there and do things themselves, who recognise that getting outside and taking part in green activities, whether formal or informal, is going to benefit them. So we do work around signposting and encouraging people to self-refer them either into activities, formal activities or informal, and that could just be as simple as going for a walk in your local park. Okay, next slide, please. Oh, we've lost the slides. Can you still see the slides? Yeah,
I've lost them too.
No, they're back. They're back now. Thank you. Hopefully everyone can see them. So absolutely fantastic. And I'm sure many of you will have realised the benefits of getting outside in nature and de-stressing and how it can help you. Oh, but I think we've lost the slides again.
Yeah, Liz, we've got your folder being shared now rather than the slides.
That
Right,
one.
we're back.
Yeah, perfect. Thank you. So yeah, we will all know the benefits, but there's been some really recent research done. So Natural England commissioned the National Academy for Social Prescribing in UCL to do some evidence work around the links between natural environment and mental health. So these papers were published just before Christmas, and you can find them on the National Academy for Social Prescribing website. And I can share the links. I'll put the links in the chat afterwards. But there's some really good evidence papers there about the linking between natural environment and mental health. And this really helps make the case for the work that we do. And you can just see I've just pulled out a couple of points there. I won't talk them through, you can read them, but so we've got some really good evidence there that's showing us that how spending time outside is associated with good health and well-being. And so that really helps us make the case locally and nationally for investment into this type of work. And there's actually some financial figures at the bottom that you can see that they've actually done some work about the returns that it can give you in terms of money invested. So there's some really strong evidence out there. If I could have the next slide, please. Okay, so just before you play this, this is a video. And it's, so don't press the button just yet, and I'll press the red button in a minute. We work with Highbury Hospital in Bulwell, which is in the north of Nottingham, and they had a community garden, and we've worked with them to turn that community garden to face the community and to bring providers into it. Highbury Hospital is a mental health hospital, part of the Healthcare Trust. So inpatients use the community garden, but equally staff use it. And also now we've got user groups from the community coming in and using it. And this is a really, really short video, which I hope is going to play and that you'll be able to hear, which talks about the value of a group around dementia, a peer support group that have been using it. So if you could press that white arrow in the middle, it should, and you've got sound up. Yeah, can't hear the sound, I don't think, unfortunately. No, there's no sound there.
Liz, it
Yeah.
might be because you were muted. I'm not sure.
Or when she shared it, it didn't tick the box. So let's try again.
I've met quite a few friends since I've been here, and the staff is fantastic. The pub that I'm attending is a garden set out for us to meet people, help them learn things about planting. For one start, it's getting me out of my own little environment at home. You know, if I wasn't here, I could be in my own garden, but that's not meeting anybody. So getting out, travelling, meeting people, meeting staff, and learning all the time. There's seed picking, we've been picking seeds, we've been picking fruit, there's plenty of fruit around, and it's nice to see the other people enjoying themselves as well and learning what things are, like radish, beetroots, tomatoes, potatoes, things like that, you know. And I enjoy it because I can help them understand what different things are and explain to them how to look after them. I mean, it's not all about gardening, we do talk about other things, you know, life in general, but it's a nice surrounding to be in to do it and to have people with us.
If you go to the next slide, please. Thank you. Thanks for that. So yeah, that's a really brief example of just the impact it can have in that peer group using that garden. We obviously evaluate and we track clients attending those green social prescribing activities, and this is just a snapshot of a movement in well-being that we've seen as we've done sort of start and 6-week and 3-month surveys with participants. We use a validated measure, and you can see the improvements that's happening as a result of them engaging in a whole range of different types of green and nature-based activities. And also what's important for the people who didn't see an improvement, they didn't see a decline, and that's really important. So they stayed where they were. And in terms of mental health, for some people, just staying stable is positive. It's not always about improving. So in terms of managing their mental health, but we think there's a really positive evidence to show the benefit of this work and of people engaging in these activities. If I can have the next slide, please. And this is, again, I said earlier, we work with the Canal and River Trust, so they deliver a range of blue activities for us, either on the water or on the towpath. So as well as sort of stand-up paddleboarding and canoeing, we also have walking and activities on narrowboats as well. And this is just, again, they use another validated measure called ONS4. And very basically, the graph on the left is the before and the one on the right is after, and it's measuring how satisfied they are and how they feel the things they do are worthwhile. And what it's showing is there are significant improvements. So in terms of us being able to share this and show that snapshot of movement in well-being and evidence the work that we're doing to show that it is having an impact on people taking part, and that's really important for us. Next slide, please. So moving forward, we're working with over 50 trusted providers. So again, going back to what I was saying earlier about the importance of link workers and other referrers having confidence of where they're referring participants to. We set up a scheme of trusted providers, which basically means that we provide really detailed information through something called a big green book to our link workers, which means they can be confident in their referrals. And for our trusted providers, we support them in terms of them being confident to receive referrals. And we set up this trusted provider scheme in order to set that up. We have our mental health levels framework, which I described earlier. And again, that's about ensuring effective and confident and efficient referrals. That means that the participant has a positive experience and is likely to return. We focus very much on mental health, but as we move forward, we want to broaden our referral pathways, both in terms of who refers, but also the conditions that green social prescribing is relevant for. So we work in primary care, but we're also moving more into secondary care around things like hospital discharge, pre and post elective surgery. So for example, if you're waiting 2 years for a knee operation, that can significantly impact on your mental health, but also your physical health. So we have examples of where people have been taking part in green activities, and it helps them manage that period of time. So we're looking at where it can help with winter pressures as well, and with other conditions. So we're doing a piece of work in Nottinghamshire in some of the old mining communities around respiratory conditions. So really broadening those referral pathways and embedding green social prescribing wherever we can. And as I said before, we are very much encouraging self-referral as well as those referrals coming through health professionals. And I think just the final slide. So this is, and I'm happy for you to share this slide or all of them around. This is just some ways you can stay in touch with us. So Green Space has its own Facebook page, and we put lots of information on there. So if you're on Facebook, give us a follow. We produce a monthly Green Spacey bulletin. If you email us on greenspace@nottinghamcvs.co.uk, we'll add you to the list, and that's got lots of information about how you can be connected in, what's happening, the different activities, our big green book, all of that type of thing. We also, that's a link, the next thing is a link to the Nature Connection Handbook that the University of Derby produced, and that's a really, really nice resource. So you can find a copy there. We have some web pages on our CVS website, which is all about green space. And finally, our big green book, which is a book that captures all of that information that we provide to referrers about our trusted providers. And the big green book has gone down an absolute storm with link workers and other referrers, because it's putting into their hands, into their what they need in order to have the information to make those effective referrals. Okay, thank you. I'm happy to take any questions.
Brilliant, thanks Amanda, that's a fantastic overview. So as before, if anyone's got a question, please raise your hand, or we can pull them from the chat if you prefer to put it in the chat. Amanda, I suppose the question I want to raise is, obviously our members are from across the whole of the Midlands region, and therefore won't necessarily be in a county or city where there's a formal GSP type project at the moment. What would your advice be for them if someone wants to get, you know, the equivalent of a localized version of a project up and running? How do they go about doing that if they're not part of a sort of pilot area?
I think the first thing, because there's 7 pilots across the country, there's a large amount of learning that is obviously coming from that. And one of the key outputs that will be available very, very soon is a green social prescribing toolkit. And we are that is using all of the learning from the 7 test and learn pilots into a how to do it toolkit. That really will cover every aspect, whether you work in health, whether you're a green provider, whether you work in a local authority or voluntary sector. So it comes from all aspects of the system. It's got great learning. It's got links to all the resources that we've developed. So things like our, that we've developed, like our big green book, our mental health levels, but equally all the resources that the other 6 sites have developed as well. So that toolkit will be is a key outcome of this test and learn. And I think that will probably be available in the next month or so, that will come out. So that would be my advice, because it contains everything you need to know to set that scheme up.
Brilliant. Okay, well, we'll look out for that, and something we can definitely share in our newsletter with our members. Caroline, you've got your hand up.
Yes, I've just put in the chat. So just to clarify things, Noor and myself work as sort of health and environment lead across the East Midlands, but not specifically, and keeping away from the green social prescribing pilots, Nottingham and Derbyshire. Our colleague Sarah Wainwright, who works for Natural England, is specifically working on both the Derbyshire Nottingham pilots at the moment. There has been a little bit of a turnover in the past, so but she's working on them at the moment. So I've put her email in the chat. So if anyone's specifically interested in a Natural England contact to do with the pilots, then that's the person you want.
Fantastic. Okay, thank you. Brilliant. Okay. Okay, so a final call then. If there's any questions from Amanda or Sarah or Caroline on the GSP topic before we move on. Okay, brilliant. Thank you very much for your time, all, and we'll share the slides obviously afterwards and all those links and so on as well from today. So next on our agenda, we have British Cycling. I think the first time we've had a British Cycling presentation as part of Midlands Parks Forum. So great to have both Nick and Tommy in the room with us today. And over to you guys for your presentation.
Yeah, thank you very much. Good afternoon, all. Just kind of quick introductions before we kind of get going. Nick Barr, Regional Manager at British Cycling for the West Midlands and Central Region. And I'm joined by my colleague today, Tommy. Go on, Tommy, do you want to just quickly introduce yourself now?
Yeah, we've practiced this. Yeah, I'm Tommy, Community Programmes Manager at British Cycling. And thanks, for the opportunity to talk about our programmes.
Okay, thanks, Tommy. Yeah, we're going to do it with a double act. I'm just going to go through who we are, what we're about, and then I'll pass over to Tommy, who's going to talk a little bit more about our community programs that we have kind of, what we deliver on a kind of local basis, but obviously covered the whole of the UK itself. So I'm not in control of my screens, and I do appreciate we did send a lot of slides in. Some slides we'll kind of quickly go through, but obviously, hopefully the slides will be sent post this kind of call, and you can take time to digest and obviously get in touch, and we'll share our details later on in terms of how to do that. But just from a point of view, so those who've not come across British Cycling before, we are kind of mandated from government to kind of deliver sport, govern sport, the cycling of sport, right from kind of an elite side, right down to kind of participation, community cycling, in terms of club governance and stuff. So yes, you'll see within our strategy, which is lead our sport, inspire our communities. Our strategy is probably about 12 months in now. Right up to kind of going up to our next Olympic cycle in Paris. So we've still got a few years left. But the main kind of principles, if you can, next slide, please, is, on that kind of elite side, in terms of from our kind of Great British Cycling team, right down to our grassroots, those people who are taking part at cycling the very first time in kind of green spaces, in open parks, and really kind of how can we connect the communities and stuff. So looking for our jobs, looking right through the whole of the pathway, from your first time on the bike right up to in terms of obviously winning Olympic medals. We won't be talking about the top end. We're very much focused within our kind of at the moment, and on what we want to discuss today is that kind of grassroots, that kind of first time participation, and how we operate as kind of regional teams across the Midlands and other regions in terms of trying to get more activation, that community engagement, and get more people cycling first time, whether you're 4 or 5, or if you return to the sport a little bit older in life. Just to kind of go back a couple of steps, obviously I cover the West Midlands and Central region, but we do have other colleagues as a region. We have 10 governed regions, and we've got another colleague who covers East Midlands, who unfortunately couldn't be with us today, Steve Johnson. So Steve Johnson is the regional manager for East Midlands and Yorkshire. So those partners who are across East Midlands, then obviously if there's anything post this call, then I can certainly put you in, Steve, in terms of any interest. Next slide, please. So just going back to our kind of strategy, these kind of our kind of 7 priorities, but we certainly, in terms of today, we'll certainly kind of go through kind of engaging that kind of children, your people, growing our communities, working together, and kind of cycling for everyone. The other ones are a little bit more kind of obviously further along our pathway, and also in terms of behind the functions, in terms of how we operate governance and equip to make a success on the ground. Next slide, please. This is just, again, just kind of giving a summary in terms of those who aren't aware of kind of British Cycling and what we do. So our community, so obviously we operate nationally, and we have kind of just around about 12,000 kind of active volunteers. We have a number of volunteer roles, right from kind of obviously the obvious ones around coaches, and those involved in our club structure. but then also we have community leaders, which Tommy will touch on in a second, right through to kind of different club roles, regional board roles, from commissaires, which kind of operate as referees and stuff. So yeah, we've got quite a vast number of different roles that we operate within our communities and stuff. So next slide. So as an organisation, we have around about, give or take, around 145, 150 members. We have 2,500, around about well, at the moment, about 2,500 clubs, kind of community groups affiliated to British Cycling. And obviously they kind of operate within mainly in our club structure, but also within kind of our community groups, community programs, whether you're community to work, but also we have our kind of junior section, which is our kind of operating standard, which we call Go Ride. So this is our kind of junior kind of club mark that they meet the operating standards that they, to function and to be advertised as a Go Ride, which basically means that they're a safe space, you know, in terms of that kind of open well-being opportunity for young people to have a go in cycling for the first time. In terms of our intake, you can see from there, you know, that one of the reasons, and we'll touch on in a second, in terms of where we want to go as a kind of organisation within our strategy, is to really kind of increase our kind of underrepresentation of underrepresented groups. So, you know, at the moment, from our membership, we're under 82% male. And you know, that's a big priority for the organisation in terms, certainly from a female point of view, how can we grow that number? Next slide. I won't kind of touch on this too much, but as you can see, there's just in terms of how kind of where the strategy come from and how we go about it is in terms of kind of barriers to cycling and obviously why they kind of go back into cycling. So just kind of flip through the next couple of slides, please. This one is really kind of the heart of where we're kind of going in terms of over the next 2 or 3 years. You know, why within our strategy, the need for change. Like I say, you know, in terms of those underserved communities, children, young people and women and girls are really kind of focused with British Cycling and over the next kind of 2 to 3 years. You know, we've certainly seen COVID has obviously had a massive impact on everyone, but certainly with the sports industry and kind of participation and the event side of things, it's had a huge impact on many organisations and stuff. So it's a really opportunity for us to kind of look at ourselves, what is our purpose going forward? And these are the main kind of 3 things that came out and certainly what we're focused in within our communities that we would like to kind of link up to. Just go through a couple of slides, please. So this just gives you a little bit more of a demographic. Obviously, we've got all the kind of information, but to fair, West Midlands and East Midlands are quite kind of similar in terms of size. So as you can see from there, we have 21 dedicated cycling facilities that range from what we say in terms of discipline specific. When I say kind of discipline, that means whether it's kind of a open velodrome, an outdoor velodrome, kind of from a track point of view, whether it's a BMX centre, whether it's a kind of mountain bike trails, and kind of dedicated centres where we're committed to delivering across the region. You can understand from their point of view what kind of different clubs and Go Ride clubs in the area, the kind of catchment of volunteers that we have around the active, and then also the kind of demographic in terms of our cycling membership in the region. And like I said, I would say the demographic and our community across West Midlands and East Midlands is very similar in terms of numbers. Okay, just go to the next slide. So that hopefully gives you a little whistle-stop tour within 5 minutes of what British Cycling does, how it operates, and the kind of the size of the organisation and what we do. Obviously, getting to the purpose of why we've been asked to join. So we have kind of 2 kind of funding through kind of 2 main aspects, really. So number of our kind of staff inside the organisation are mainly funded via kind of Sport England. Obviously, we're looking at kind of the community and participation side of the sport, and then obviously we're funded by UK Sport. We kind of looked after the kind of elite side of things as well. Another kind of sector of our kind of funding comes through kind of our partnership work, and that mainly relates to kind of local authorities who have kind of shared objectives and shared kind of priorities about kind of increasing cycling and trying to use cycling as a kind of a community engagement point of view, try to activate spaces, kind of traffic-free spaces, green spaces, and they kind of obviously want to work with us as an organisation on a kind of a joint adventure you know, in terms of providing activation, like kind of provision for kind of organised activity for underrepresented, for choosing people, for adults, you know, and to increase their kind of workflows. How can they use cycling as a, you know, active travel, or even kind of looking back to kind of previous presentations, and that as a way of kind of prescribing as well. So there's different interventions that we can help support local authorities. You know, nationally, we've got over kind of 30 partnerships where we're activating this. For example, kind of East Midlands, where we've got ongoing relationships with kind of Nottingham, Leicester, West Ham, you know, Coventry, Sandwell, Solihull, Combined Authority, Forestry England and stuff. So, you know, we've got a number of active partnerships. We have a number of roles that kind of come into those partnerships. One being kind of a generic kind of cycling coach, and you can see some of the activation there. This is just some of the photos from Cannock, where we're kind of activating at Cannock, and obviously that's kind of a post Commonwealth Games legacy piece and the kind of investment that we've made into the kind of centre at Cannock. But that's just one example. But, you know, different coaches, for example, you know, in Combined Authority and coaches going into different areas of the community, whether it's traffic-free parks, open spaces to activate. And depending on that kind of relationship, that kind of conversation with the stakeholder and the partner is, you know, what is the kind of key audience and key demographic that we're looking to target that. Next slide. This just gives you a little bit of example of some of our kind of activation. This comes from another program, but again, it's a similar kind of way of working. You know, first step, that first engagement, that first kind of provision doesn't have to be always in a kind of cycling, you know, a dedicated cycling facility. You know, we are certainly within our strategy in terms of that outreach work, how flexible we can be, you know, so we're not always relying on kind of postcode lottery where our kind of our mainstream clubs are. We know as an organisation, for us to kind of reach those underrepresented groups, to grow our kind of demographic from our kind of membership base, that we really need to kind of target different spaces and different opportunities within the community for us to kind of link to our kind of pathway. And so, yeah, that's the kind of model. So, yeah, in terms of the kind of first opportunity, it is really kind of flexible. And then it's about how can we create those opportunities into our pathway and you know, in terms of our kind of, you know, in terms of the opportunities that we offer anyway. Next slide. This is just another example from the different side of things. This is more from a kind of physical activity, you know, social well-being point of view. From a kind of a community developer, and this is kind of going nicely linked onto some of the stuff that Tom is going to touch on now. But, you know, some of the kind of role as well is from the adult's point of view, and you can see some examples in the photos on the screen. These are some of the kind of projects. This was, I think, over in Nottingham and also Coventry as well. You know, these are kind of specific projects about kind of getting females back into riding for the first time, you know, program of learning, and take them on a journey over a period of time, to give them that confidence and also to do it in a safe space and to learn with others and really kind of try and keep that kind of community feel really in terms of wanting to cycle. So yeah, you can see the different examples, and also not just from a participation point of view, but also kind of building from a volunteer workforce and, you know, really looking from a sustainability point of view, how can we sustain those programs, not just for, you know, just one-offs, you know, or 6-week, 8-week, but there as a longer term point of view. I'm going to pause there because I think it's a nice link into Tommy. So Tommy's going to touch on some of our national programs, but obviously how then it kind of integrates into our regional work.
Cheers, Nick. Thank you very much for that. Yeah, good afternoon, everyone, and thanks again for the opportunity to talk more specifically about the programs that British Cycling run, and I suppose how it kind of supports the activation of parks and green spaces. Yeah, next slide, please. So when I talk specifically about the programs that we run and deliver, there's a few different ways that kind of I want to think about it, whether it's, you know, a chance to kind of obtain the program and activate that space, or whether we're already doing existing work within your space, and you can kind of champion and cheer it. And then also, you know, think about yourself. I suspect there's a few people here who have got bikes in the shed, and a little bit hesitant about going out with the bike. And hopefully some of these programs might inspire you to get on a bike. And just to kind of add a bit of context, I've been working at British Cycling for 9 years. I probably look like the typical mammal, lycra clad roadie, but I'm super passionate. I'm just want to get out on the bike, connect with nature, and then just enjoy getting on a ride, and that sense of freedom. And that's something that I'm passionate about, and trying to help people do the same. And that's kind of why we've got this suite of opportunity that I'll talk through, that, you know, appeals to different types of people and different types of cyclists within your communities. All of our programs are linked on our Let's Ride website. It's kind of our community-facing website, as we appreciate as British Cycling. When we mention the name and the brand, there's definitely a lot of perception about the elite level, gold medals, and, you know, a lot of costs associated with it. So we have our own Let's Ride website that kind of is more appealing to everyday people and everyday cyclists. So feel free to check that out after. Nick's just put that in the chat. Cheers, Nick. Thank you very much for that. And you'll find all of these programs and products that I'll talk through on the Let's Ride website. Next slide, please. So the first two is breeze and guided rides. Now, these are small group rides, and they're led by qualified leaders. So these leaders, they are volunteers, and they are trained with a specific qualification in ride leadership. And that gives those volunteers the confidence to take small groups out, whether that's on a very short distance kind of traffic-free ride, or whether it's a little bit longer, kind of integration into roads, and overcoming that kind of confidence barrier with that. So the two programs are split. So both volunteers have the same training, but kind of the outcomes of that training and what programs they want to support and who they want to support differs. So the first one, we've got Breeze, and this is our women only program. Now, Breeze has been running for 10 years now, and grown and grown and grown. And you'll see that the bottom bullet point there, recognised as the biggest behaviour change programme ever to get women riding bikes. So we're super proud of it, and it has, you know, such a purpose, and it brings a sense of community to women, and to get more women riding. So it is women only. The volunteers, they are Breeze champions, and they are women also. And it's just a really great space there for women to kind of build up their confidence with like-minded women, and get them riding. Whereas guided rides is a little different. It's open to everyone, but with a focus more on families, and kind of that entry level type of riding. So predominantly, you know, these rides could either start or end or ride through traffic-free spaces like parks. So, you know, real good opportunity there to connect with those guided rides. Yeah, mixed gender, open to all, and it really helps kind of that pathway of riders who, you know, are keen to ride, and want to do more riding, but they're not really that confident with knowing where to go, or maybe not that confident with riding on the road, or even they just want to kind of ride with like-minded people. So, you know, these two programs really connect those types of riders, and supports them. Next slide, please. And so with those kind of led rides, they are kind of time specific. So the volunteer would organise it at a certain time and place. Now, we recognise that not everyone, you know, not everyone is motivated to ride with other people, and also kind of they have their own barriers in terms of time limitations. So we've got an offering on Let's Ride where they can find and download routes in their local community. And you see kind of a few stats there about kind of what we've got from riders, that helps us kind of shape this product. So again, kind of the emphasis that we're going towards is traffic-free spaces, but also connecting people with nature. and parks feels, you know, integral, green spaces feels integral to that, as well as, you know, other similar environments. So, you know, we want to have kind of a real big shift towards that, to try and get more people riding and find out in their local communities, you know, where they can ride. Part of this as well, we've received a small amount of funding from Sport England to really focus on the West Midlands following the Commonwealth Games. So we're working with them to kind of grow the number of routes we have across the West Midlands with that specific focus of connecting people with nature, but also trying to diversify the types of cyclists we get and really connect with those local communities. So we're looking to kind of innovate our offer on Let's Ride digitally, but also, you know, how can we make people more aware of great routes that are really local to them, and whether that's kind of, yeah, physical promotions in local spaces. Next slide, please. And again, thank you. So Pedal Party, another program that we offer, and these are events. So we've had led rides, we've had kind of a route product, and Pedal Party are kind of small scale, regular events. And they are for families with children who are kind of developing their ability to ride and their confidence. So what I'm going to do is just put a spotlight on Pedal Party for a couple of different reasons, because pedal parties work fantastically well in green spaces and parks because they connect to local communities, and it's a real brilliant space to kind of get on the bike and ride around in a safe and fun manner as well. But unfortunately, we don't have any pedal parties in the Midlands currently that are in parks and green spaces. So it's kind of a bit of a, yeah, great reaction, a bit of a call out there. So if this is something that kind of might interest you, then yeah, I'd love to speak to you. So next slide, please. So pedal parties, a little bit more specifically about it. We offer these because we recognise that families are in a little bit of a juxtaposition with cycling, because they have so many barriers towards cycling, but they really want to do it. And when you speak to kids of a certain age, they are so keen to get on a bike. You know, these kids can be fearless and just kind of jump on and want to do it. But time, space, cost, all of that, you know, just throw in so many barriers, and even just trying to travel to a safe space. So what we try and do is kind of target and overcome those barriers and try and make cycling as easy as possible for the family, but also try and support with that progression as one. And what we see is that the kids progress and the adults also progress their cycling as well, which is fantastic. As it says on there, the dynamic of the families can be completely different, and you actually see sometimes bigger gains in some of the parents than the children. But ultimately, if they can kind of come to a few pedal parties, ride around, build up their confidence and skill, and then, you know, afterwards they can go off riding together at their own time and leisure without kind of our hand holding and need. Next slide, please. Thank you very much. Formatting must have gone on this slide, but kind of the aims of Pedal Party, the top one about physical literacy. So it's still a new topic, physical literacy, but it just looks without kind of, you know, people might already know about it, but physical literacy looks at the whole aspect of being active. So part of this is that, yes, we want to kind of develop the skills, but we also want to make people aware and make the children really knowledgeable about kind of why they're doing it, and kind of how they can continue to progress. So the activity is kind of underpinned by currently our Ready Set Ride product, which is how we can kind of teach kids, how parents can teach kids kind of how to learn to ride and take those real basic skill developments on a bike. With an aim, therefore, if children can kind of ride and ride independently and have fun with cycling, then the next step would be to kind of, if they want to join a club or group, and the more we speak to families at these events, the more they want to see their kids, join clubs and groups. Next slide, please. Okay, so there's a little bit more detail about kind of how we do it. So in the yellow box, there's kind of the bread and butter stuff that you get with Pedal Party. But what we love to see in here is kind of the bottom box is how Pedal Party can be enhanced and how we can plug in other aspects within the community, and help kind of grow the offer, and grow the experience at a Pedal Party. So typically, as Nick said, we've got community coaches that we could potentially plug in, and they could offer some real specific coaching, and support with that kind of next level need of development within there. Bike hire is great in those spaces as well. So families really struggle to kind of get all the bikes in the car and come down to a green space, or park. So if there's bike hire available in some form or another, then the whole family can get riding. So just wanted to kind of raise a couple of those examples there. Next slide, please. Okay, and just in a capture about how it kind of works. We want to work together to kind of build the offer and make a really great experience for these families. So what kind of is fundamental to all this is the volunteers that deliver it. And we offer training and support to those volunteers, but collectively, we can support, promote, and engage with those communities, underpinned by that guideline for delivering fantastic Pedal Party events through volunteers. So it is definitely a case of working together to make these events as best they can be. And then final slide, I think, on Pedal Party. And just to bring it to life a little bit, so this is an example at Peel Park in Bradford, where we deliver activity, these Pedal Party events, and you can see kind of some of the main aspects in the yellow of how we've kind of plugged in other support within Pedal Party. But then in the yellow boxes, just a few more about kind of the periphery. So the kind of main objective of these events at Peel Park is to engage with that local community, who are challenged with kind of riding and having the opportunity to ride. And actually the research that we've got there says that they don't really utilise the park as much. So we've done quite a bit of outreach there to engage with the community and get those people out of their houses and into the park on the weekends. And we're seeing great success with kind of not just the people and how local they are, within 5-10 minutes of the park, but even their progression and development. And we're seeing kind of the families, see cycling as a really fun and accessible activity. And we've even got like one great story from last year of a lad who joined the local club. So we're really fortunate that we've got a local BMX club that operate at the other end of the park. And he's joined them and he's having a great time with them. So kind of for us, that's a really good holistic picture of what Pedal Party can do. Next slide, please. Actually, the next one as well. And I'll just finish with kind of all of those programs. What ties them together is that we want to really promote cycling as kind of not just all the great stuff around the elite and the gold medals, but also that it's a normal activity, and hopefully these programs kind of shine the light that communities can get involved with cycling no matter what their motivations and needs are. And I'll pass back to Nick.
Thanks, Tommy. We'll probably end the kind of slide deck there, and I'm happy to kind of open it up to questions. I will drop in some kind of contact details because I appreciate me and Tommy have whistled through in 20 minutes about a lot of things there. So I think probably I'm happy to take any questions from the screen, and also I've dropped contact details in for it, and I'm obviously happy to direct you whether kind of conversation with Tommy or contact in terms of Steve across the East Midlands if you want to get in touch further.
Brilliant, thank you both, much appreciated. There's a lot packed in there. I know there's a couple of notes in the chat from Ruth, who's our next presenter as well from Sustrans, and also then from Tasmin about getting involved, for example, from the Lichfield District Council. So do you want to just sort of address how can people get involved with British cycling in their area? What are the opportunities? And I guess one of the questions often will be from people about funding that's available as well.
Yeah, I've seen some of those. I think probably the best thing to do from Tasmin, and I think it was Ruth. Yeah, I've just dropped my email address in. Please just send me a quick message and let's kind of catch up outside this call. I think that's probably the best way. Obviously, the kind of funding kind of scenario is always an interesting one. I think it's always about kind of scenario we're in. Also, kind of the area you're in, your kind of partnership relationships and the work you're doing. So it's always a kind of a different conversation per kind of local authority, I would say, in terms of kind of the wider aspect. So it's not. I don't think it's a not to avoid the question, but it's a difficult one to answer really, because the scenario is always different.
Okay, right. So we've got a question from Sinish. You've got your hand up.
Yeah, thank you. It was just a quick insight that we at Sandwell Valley have been successful working with colleagues from British Cycling and Sport England in relation to a cycle track both in Sandwell and over the border in Birmingham, and we're due to start work actually on site for our family orientated track in February. So that'll be more of an introduction for people that get into cycling, and then Birmingham have got a more adventurous part of the route on their side. So that will be something that'll be quite exciting within the the West Midlands, really, to attract people as part of the legacy from the Commonwealth Games.
Yeah, thanks for that, Sinish. And I think that'd be great for us as a forum, perhaps, if we can host. I know we've got a Sandwell visit coming up, haven't we? But to yours or other authorities' facilities in the future. For example, I know you're doing a big project in Warwick and Leamington at the moment, aren't you? With a Newbold Common, examples like that. I think people are always, grateful to see examples of stuff happening in the flesh as well, which could be useful for the future.
What we can do is, I know we're hosting on the 30th of March, so potentially our side will be done at Sandwell Valley. So I know we're talking in with Alison to maybe try and link the Valley in, but that could be something that we could talk more on at the next forum meeting. Thank you.
That's great. Thanks, Anish.
So Nish, can I just jump in? Sorry.
Yeah, Christian.
Have you, just a quick one. Have you picked up or met Stephen Brown?
Yeah, we have. Yes.
All right, brilliant. Yeah, that's fine.
So perhaps Nick and Tommy, if we come back to you and others about, what good examples there are out there, as well as obviously the ones that Snish has mentioned for perhaps a future visit or something would be great.
Yeah, that's absolutely fine. Just keep in contact with us. That's absolutely fine.
Brilliant. Okay. So assuming there's no more questions from people, we're about 5 minutes ahead of schedule, I think, which is great. So we're going to take a 10-minute break now, just because I'm very aware you've all been bombarded with a lot of PowerPoint slides so far. So time for you to go and put the kettle on. And we're going to come back at, we'll call it we'll make it a 5-minute break or 6-minute break, actually 3:45 to stay on track. So if we say 3:45 back here, and then we'll have Ruth from Sustrans and Anna from the LTA after the break. So see you all in 5-6 minutes. Okay, thanks.